Today I'm going to be talking about groin hernia repair. This can be done with a small open cut or with keyhole surgery. That's me with my hands using laparoscopic instruments or me operating a robot to do the same operation, keyhole. This is a great operation for people who are struggling with an inguinal hernia in their groin. The operation reduces the hernia back inside the tummy and fixes the defect in the tummy wall with a mesh. There are some risks that you should be aware of: risk of damage to surrounding structures, a lingering pain in the groin, or a wound infection. But these are rare, and the vast majority of people will have a simple day case operation for which they'll be able to go home the same day. Although you'll want to get someone else to collect you, as you will have had a general anaesthetic. You should expect to be back at work within a week or two and taking simple pain relief for at least the first week or so.